meeting after the SDGs to discuss health, and also the non-governmental partners, JCIE, and our champion, Professor Takeme, and everyone else in Japan, but also all the other partners. I'm somewhat at an advantage because Bill Gates gave almost all my talking points, so I don't have to go into a whole lot. But one of the interesting things about the SDGs in some ways, for many of us, I think, is it really calls us to focus on the person, to move beyond individual issues, diseases, to focus on a person and what a person needs, and then through the person, the family, the community, and the country, and to try to put things together in the country, as Minister Tedros just mentioned. And that requires an equity approach. And it's something Japan has been talking about for a long time from a human security perspective. Others have talked about it from a human rights perspective. And from a global fund perspective, because we deal with diseases that are functionally inequity, are diseases of inequity, particularly HIV and tuberculosis, but also malaria, the marginalized, the left behind by society. It's often been in our DNA to focus on a person, to focus on equity. And so that's one thing the Global Fund, I think, very much resonates with the SDGs on. The second is that it's going to take all of us working together to achieve that, if we're going to really focus on a person and not just an issue. And our work created like Davi is a 21st century partnership and a public-private approach to bring everyone together to support the country. Which brings us to the specific goals in the SDGs to health, but also that person focus. So to achieve the health objectives, which focuses on a person, means health in general, UHC is an underpinning of that, and it requires all of us in partnership to come together to provide quality services, but under the national plan. And we have many ministers here who lead that effort, lead the effort in the country to ensure that we are all working together under that national leadership to support a common objective. No one institution is going to be able to do it, so it requires us all to come together, to work together to support the country for health, for its people in an integrated way. Now, the Global Fund's been a piece of that for a while. As Bill mentioned, about 40% of our investments have always supported what anyone would call health systems. In some countries like Ethiopia, it can be 60% of the national program. But with our new strategy, our board is pushing us to really focus on the title of this meeting, Resilient and Sustainable Health Systems, and our role in that. No one owns all of it, but our role in that, working together to pull the pieces together for a country, so that a country and the partners deliver for the country to have integrated health, universal health coverage, health for all, equitable health. The second piece of it actually challenges us even further, not just to work together in health, but to work together across sector. And in some ways, this can be even more challenging because, and here again, I think HIV and TB are somewhat interesting diseases because many infectious diseases are indiscriminate. Doesn't matter who comes in contact with them, you're going to get it if you have the genes and if you have the right contact. HIV and TB are very discriminate diseases. They affect people who are left behind by society, as I mentioned. And in some ways, they are very discriminating infections. And so they are, in some ways, diseases of society as much as infectious diseases. And so we have to cross sectors if we're going to focus on the person and solve these problems. And that means, for example, linking education and health, which are drivers of development, but also essential for adolescent girls and young women to have equity in their society. So we're actively working with the World Bank and GPE and UNFPA and many of the partners here to support countries so that they can develop equitable programs across education and health for adolescent girls and young women so that they can have equality. Now, what happens when you have this equity and a focus on health more broadly and cross sectors is you get an enormous return on investment. So it's actually been estimated that $1 invested in HIV, TB, or malaria returns $17 to $30 to the economic growth of the country. And that allows for growth and development. It allows for us to have societies that are of size, like UNFPA works on, so that we can all have equitable health, but actually equitable societies.
Thank you, Mark. That was